There are certain stages of our life where our skin changes a lot, and a big one of these is in our 50s. The average age of menopause in the UK for a woman is 51, and around this sort of age our skin can go through some fairly dramatic shifts. You may have skincare that you've always used and loved and has always suited your skin, and all of a sudden it's just not doing it enough anymore. So what can we do if we're looking to be anti-aging and we're around that decade of our lives? First up, collagen loss. This is a big one around this age. So within the first 5 years of perimenopause, we lose about 30% of our collagen. It's a lot. You will notice almost universally a rapid aging spurt, that your skin becomes less firm, that you develop more fine lines and wrinkles. Thinking about using a good retinoid if you're not already, and if you are, upping the ante on that retinoid is a good place to start. Retinols are a really powerful collagen stimulating and anti-aging ingredient. I'm a big fan of including this at younger ages, but certainly upping the ante if you're not already using one at this point in your life. And you can also, from the collagen stimulation aspect, think about AHAs, because they also help to stimulate collagen production in the dermis. A good product with glycolic acid in, or if you've got a slightly oilier skin, maybe some salicylic acid. Lactic acid is another good ingredient, but these are good ones to be thinking about. Another major skin concern that becomes more apparent around this stage is hyperpigmentation. Hyperpigmentation is irregular skin coloration, so dark spots which appear due to UV damage that's often happened decades ago. Because often by the time we get to our 50s, we're much more skin aware, we have more knowledge, we're using better products than we were in our 20s, and you can be thinking, but I use SPF 50 every day, I'm using a great vitamin C serum, why have I still developed these pigmentation spots? And it's because the damage was done decades ago and it's just coming to the surface now. So thinking about good anti-pigmentation ingredients, I'm a big fan of vitamin C, but on its own it doesn't really correct pigmentation that successfully. So combining that with other ingredients like kojic acid, for example, licorice is a good one, or thinking along the lines of more powerful cysteamine or hydroquinone, which can work very effectively. Another big one that tends to happen is dehydration and dryness. The skin does become much more sluggish, it produces less hyaluronic acid, and the barrier itself becomes far less robust. We have less lipids in our skin, and so we're less good at holding water in the skin. So overnight you'll get more transepidermal water loss, and you'll wake up with far drier skin than you did maybe a decade earlier. Lipid-rich creams are a good place to start, unless you're a very oily skin or more breakout prone, in which case you're probably not suffering this problem in the first place. A rich ceramide-based product that also contains some fatty acids is a really good inclusion. Some favourites for me are the SkinCeuticals Triple Lipid Restore or the Skin Better Science Trio Rebalancing Moisture Treatment. They're both excellent choices which will really help to replenish the skin barrier's lipid levels. Also thinking about having in there a hyaluronic acid product which will help to rehydrate the skin. So you're working on keeping water in the skin and also stopping it from evaporating. So you're really targeting hydration from multiple levels. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.